Common sense still needs to prevail. I need every single South Dakotan to be diligent, to be responsible, and to think about your neighbors. Being a good community member means that if you are sick, please stay home. If you think you're infected, call your provider, call your doctor before going into their emergency room or into their clinic. Healthcare worker exposure is a concern, and we have to continue to mitigate the risk by being smart. Now, we know that this is not just a 2-week problem that we're dealing with here in the state of South Dakota. We have been studying data and facts and science and looking at models that have come from throughout our state, surrounding states that are dealing with this virus in our country and in other countries to predict what could happen here in South Dakota. Our models suggest that up to 30% of our population could get sick. That is literally tens of thousands of people in our state. Now, I understand that that's scary for some of you, but remember that more than 80% of infections are asymptomatic or cause mild illnesses. We need to make smart decisions. We know that where we are today has been proactive. The actions that we've taken is working, but we still have a long ways to go. Our projections indicate that we will not peak, which means we will continue to increase in positive COVID-19 tests into May, possibly early June. So we need everyone to stay calm and be patient and to make sure that they're making good decisions for them, for their families, and for their neighbors. I want to go over some of the testing results that we had yesterday. We had 7 new positives to report. One of those is from a private lab. 3 are hospitalized right now, and we are currently investigating and speaking with them to get more details of the individuals that they may have been in contact with and making sure that we're working ahead to take care of those individuals. I wanted to touch on some unemployment numbers that we're seeing here in the state of South Dakota as well. In the week of March 2nd, South Dakota received 185 claims. Now, under normal circumstances, the Unemployment Insurance Call Center operates with about 11 staff. Since the significant influx of claims, we have added 16 more staff members in this area to help take calls, to reset passwords, and process online claims. We have 92 phone lines that are available today. We are adding an additional 23. Many of the claimants that we're seeing are first-time users of the system. They're unfamiliar with the process, but know that we are working to get as many lines up and going and getting more staff online to respond to the unemployment requests that we are getting. The issue that I have in front of me each and every day is one of compassion, making sure that we're being proactive, taking care of public health concerns. Thousands of people in South Dakota whose lives depend on public health guidelines that we are providing need us to be calm and to make sure making wise decisions on their behalf. We also have tens of thousands of people in South Dakota whose lives depend on a functioning economy, and that deserves compassion, that they pay their bills, keep a roof over their head, and have the ability to buy food for their families. I am working on an executive order, which I will sign later on today, that will provide guidelines to businesses, to healthcare providers, and to community leaders that we will use science, data, and facts to have at our disposal on how we will operate in the coming weeks. And again, I just want to remind the public that this is not something that will be over in a week or two, that we project that we will continue to see dramatic increases in infections for the next 8 weeks and work to continue to proactively take care of people and know that this is something that South Dakota does best, is join hands, work together, and take care of each other. With that, I will open it up to any questions that you may have.
Governor, this is Stephen Groves from the AP.
Hi, Stephen.
Hi. So, you, as you said, you're making decisions based on data. I'm wondering, with the current testing capabilities, is that data limited? And then with a lag in commercial testing, does that create, that's almost a week old. How does that figure into your calculation?
Well, we do have our lab operating. We're running those high priority cases every single day. We do have commercial labs that are operating. It takes longer to get their results back to us. But I do want to give some perspective to this whole conversation. As we continue to see more and more infections and positive cases come back, I will not be able to continue to give you the kind of detail that we have been on these cases. There will be many, many positive cases coming in every single day. So the information that we're used to receiving so far in South Dakota, we will not be able to provide to you. There will be a point where there will be so many cases that we understand we'll have to focus on taking care of people, keeping them isolated, and that is why it's a reminder for everybody to be responsible. If you aren't feeling well, you need to stay home. We will be getting more and more increases going forward, and that level of detail that we've been providing would be unsustainable into the future when we get more and more of this spread throughout the state.
So you're saying that we're going to see this statewide, and that level of detail, it's kind of mass action now.
Yeah, this is something we've been talking about for weeks. Back in January, we started preparing for this. In February, I opened up my Emergency Operations Center to get ready and prepared for this. It has been fully operational with every agency and department from state government partnering with healthcare providers to be a part of this. We also have been slowing and bending the curve. Every action that we've taken so far has been working to make sure we didn't have a huge spike in infections and people that are getting sick right away. That has been working, but also know that doesn't mean that we're not going to continue to have people get sick in South Dakota. The models that I have seen, again, indicate that 30% of our population could get infected. That is based on data, that's based on facts, that is literally tens of thousands of people in our state. And that is a reality that we all need to come to grips with and be prepared for, and know that the work we're doing today sets us up for taking better care of people into the future.
This is Governor.
The one thing I want to remind South Dakotans is that 80% of the people who will get this virus have no symptoms or very few symptoms. So this is not a time to panic. It's not a time to go out and be insecure in what we're dealing with. Just know that that is the infection rate that we'll be looking at, and that we need to be prepared, listen to our healthcare providers, and use facts and science to back up every decision that we make.
The 30%, would that be at one time, or is that over a length of time?
That's over a length of time, and that is why we're trying to spread out and slow down the rate of infection. And what we have been doing over the last several weeks is, if 30% of our population were to get infected all at once, our healthcare system couldn't handle that. So that is why we've been taking proactive action to isolate people, keep them at home. It's one of the reasons you've seen our president ask for a 15-day isolation period where everybody in America stays home, is to bend that curve, to flatten it out so that we have fewer people getting sick at one time, and making sure that we're making responsible decisions. So throughout this entire pandemic that we're seeing in South Dakota, the reasonable projections based on data say that 30% of our population could become infected.
Governor, this is Chase with the Huron Plainsman. You had mentioned the peak would be May to early June. In your executive order that you plan to deliver, do you intend to have any guidance for schools and how they should operate, as that would more than likely mean that the peak of this disease should probably cancel our school districts?
We are still working on that. We have several different plans that we're working on as far as working with different school districts and administrators. Obviously, we want to limit group sizes. We want to limit interaction and getting people infected, but we also want to make sure that our kids are having an opportunity to stay educated. That's what's been encouraging, is to watch how our teachers and administrators have gone above and beyond to make sure they're still delivering educational materials and opportunities to our kids at home or wherever they may be. So we will give some long-term plans to how we will educate our kids here in South Dakota as well in the next day or two.
Governor, with the peak will we be isolating in place and will work at home continue past that 15-day window now?
Yes, the 15-day window was always something that was given at the national level, and things that we were judging week by week. We will give some clarity to that to businesses, healthcare providers, and families and communities on how we will tackle the next several months. Today.
Governor, JT5 from Watertown. The rumor is that we now have cases in Watertown. Can you confirm that?
This is Kim Malsom-Reisen with the Department of Health. We can confirm that one of the new 7 positive cases is in Cottington County. That will be posted to the covid.sd.gov website shortly. What I can tell you at this point is that of the 7 new positive cases that came in yesterday, 2 are in Beadle County, 1 is in Cottington County, 1 is in Davison County, 1 is in Hughes County, 1 is in Lyman County, and 1 is in McCook County. And I want to remind all of you that as these coming days unfold, it will be very difficult for us to continue to give you details on everybody that will test positive for COVID-19. We will start getting more and more positive test results across the state and many in different counties as well. So I want everybody to be prepared that we will do all we can to give you information, but that we are entering a time frame where we're going to see those positive test results ramp up. And your best option is always to go to the covid.sd.gov website. That is continuously updated on positive test cases, negative test cases, how many are pending. We're putting all the information there for businesses and families, for economic development, small business loan assistance. All of that information is on covid.sd.gov, and it's incredibly important that if you want up-to-date information to always be going there as well.
Is there any plan for freezing mortgage and rent payments in the state?
I'm sorry, I couldn't understand that question. Let's take a question on the call. I believe it was a female asking it.
Yeah, hi. Is there any plan for freezing mortgage payments and rent payments in the state for people that are unemployed?
Obviously, there's discussions with financial institutions and banks, but no plans to announce at this time. Bob, did you have a question?
Yeah, 2 real quick.
Okay.
One, do today's numbers come strictly from the state health lab? And then a related question is, have you heard back from the outside labs yet?
We have 1 positive case that came to us from an outside lab out of the positives that we've announced today. And we do still have approximately 700 tests that we're waiting for from a commercial lab to deliver results to us in. We think that we'll get those results from those tests within a day or 2.
Governor?
Well, in many other states that are much more advanced in the spread of this virus and that already have community spread in many of the areas of their states, they have stopped testing individuals. Because there's so many people that are coming down with symptoms that have been in contact with positive cases, they have stopped testing altogether, focused on knowing and taking care of those vulnerable population, putting their focus on taking care of those who might be in more of a critical situation because of health conditions or because they're elderly. There will come a point in time where South Dakota will need to do that too, where we will need to focus on making sure that we're protecting those that this would be very damaging for their health or threaten their lives. So while we put a lot of faith on testing to track the spread of the virus so far, there will be a point in time where those who are healthy that are younger may not necessarily get the tests because there will be so many folks impacted by that. We'll need to focus on those that have health conditions that need extra attention. Yes. This is Kim Malsom-Reisen with the Department of Health. I just want to add one other point to that dialogue. It's important to remember that we don't have specific treatment for COVID-19. And so the instructions that providers give individuals is to remain at home, stay isolated from other people, and monitor your symptoms. Call your provider if your symptoms get worse. And so to the degree a person has those symptoms, that's going to be what the provider recommends.
Infected?
identified together.
This is Kim Malsom-Rice, and we do, on a daily basis, get a census of hospital bed use across the state, as well as critical equipment and its availability. We work with hospitals every single day on their surge capacity. That means how would they deal with an uptick in numbers. Hospitals do have that planning. We work very closely with them to ensure that that planning is ready to go and that we have as much surge capacity as we might need in those communities.
Does the state have a plan yet for the $4.5 million we received from the CDC? And do we know if that's going to help patients who are struggling to pay for testing and that kind of thing?
Sure. So we just received the guidance on the initial funding that the Department of Health received to help with our response so far. We are currently working to see how we can support hospitals in particular with those funds to ensure that they have what they need to buy the supplies that they need moving forward. So we will be announcing opportunities for that yet this week. But so far, funding has not been an impediment to us responding.
So the money is going towards hospitals then? Will it help pay for ventilators and testing and protective equipment?
Hospitals will be one part of how those funds are spent. Of course, we've got things happening in communities across the state, and those funds are intended to help with all parts of the response.
I got a question. This is Michael.
Are you?
Sorry. Oh.
Any further questions?
I got a question from our news about related to the younger people who are, in other states they're seeing younger people who are hospitalized. So you had mentioned that vulnerable people are at risk, but in New York and some other areas, they're seeing that younger people are getting more severe symptoms. Could you address that? I mean, I don't know if we have enough data to understand if that's happening here, but how will you address that so that about the younger people?
We are obviously working with everyone who tests positive right now. Our healthcare providers are heavily engaged with them and monitoring them. If someone is younger and they have pre-existing health conditions or are compromised in their health in some way, that certainly will impact them when they catch the virus in a much greater manner. So, that is something that individually these doctors are working with their patients to care for them going forward. Where obviously it's a virus that we're still learning about every day. There's new information, new data, and we're tracking that all the time to learn what we can and looking for therapeutics as well, which the FDA and CDC is focused on partnering with everyone to come to something that would help those that are showing symptoms.
How bad would it have to get to institute a so-called lockdown across the state the way they've done in Ohio and New York and California?
Well, we aren't at that point in South Dakota. We do have plans and of utilizing some resources at the state level that we would need necessary. Our National Guard is fantastic and has some resources we could bring in to deliver more health care and help us set up operations in communities that would need it. I've been incredibly impressed by the people of South Dakota and how innovative that they've been and responsible. One thing that I would like to encourage people is that if you're nervous about this, if you're concerned about catching the virus, stay home. Don't go anywhere. You have every opportunity to protect yourself and your family by staying home and not leaving your house. And that is something that, we see a lot of folks that have concern and are expressing that. Take care of your neighbors. If you're concerned about it with your family, if you have health conditions, stay home. Wash your hands. Practice good hygiene, make good decisions, and we will get through this. But just know that this isn't going to be over in a week. I want everybody to be ready to understand that we have to sustain our operations for at least 8 weeks, that whatever decisions we make today, whatever business decisions, whatever kinds of lockdown decisions, whatever schooling decisions, educational decisions, we have to be able to sustain those for at least 8 weeks. And that is one of the viewpoints that we're constantly looking at everything that we're doing, knowing that we need to make sure we're making the best decisions to take care of people and their public health. So I want everybody to take care of your neighbors and your communities, make good decisions, be smart, and also be responsible. Personal responsibility is incredibly important at this time. I cannot tell you how much that will mean, not just to your community, but to your family and to your leaders that are trying to make difficult decisions, that if you will take responsibility for yourself and your actions to stop the spread of COVID-19, that will make all the difference in the world.
Governor, can
Yes.
you clarify your emergency powers in this situation? Can you order a shelter in place? Can the Department of Health order non-essential businesses to close?
We will be discussing some of this in the future when the executive order comes out, and we'll give you some clarification on what my guidance is going to be to the state when it comes to businesses, healthcare providers, and to our community members. We believe there is.
Governor,
Okay.
can I ask if you are considering postponing or halting elective surgeries?
We will give you more guidance later on today in that area.
Okay. And
Thank you.
Just as a follow-up to that, can I ask if abortion would fall underneath the elective surgeries?
We will be visiting about that later on today.
Thank you.
Thank you.
Thank you so much.